Hello, welcome to the weekly wind-up with myself, Emma Kirke. Today I'm joined by Marc Brodie from Community Integrated Care and he's popped in to tell us all about the fabulous work they do in our communities and a very, very exciting project that has recently been announced. Welcome to the show.
Thank you for having me.
I did get that right, didn't I? Community Integrated Care.
It is. Yeah. Community Integrated Care. Yeah.
Perfect. So tell me a little bit about how you became involved with that particular charity.
Yeah, so I've worked for the charity for a couple of years, but have a long background in social care.
Okay.
Community Integrated Care is one of the biggest social care providers in the country.
Yep.
Provide care and support to over 5,000 people, right from the north of Scotland all the way down to Portsmouth.
Okay, so very national based.
Yes, yeah. We're a national organisation, but we have very close community links in all of our communities, and that's really important to us and at the heart of what we do.
Mm-hmm. So what is it exactly that your charity does?
Yeah, so we provide care and support, which are two slightly separate things. Care and support to people with a range of different conditions or abilities or disabilities.
Mm-hmm. What kind of things do you do?
Yeah, so we provide support for adults with learning disabilities, maybe living in their own home or living in one of our service settings. Mm-hmm. We have services for the elderly as well. We have specialist dementia care and some of the more complex care as well. So we have a real broad range, but as I was saying, we try and everything that we have is linked back to the communities that we support in.
Okay, so when you say support, do you mean you have a physical carer that goes in and helps them?
Yes, yeah.
Okay.
Yeah, so we have support workers, fantastic support workers we have all over the country. They really are at the heart of what we do, and they really make that work so well. They're so special, and I think the social care sector generally is a little bit overlooked. There's always a lot in the news about an underfunded NHS system, but very little kind of discussed about the underfunded social care sector, which is becoming, unfortunately, more and more underfunded as time goes on.
Mm-hmm. So that's obviously where you guys are trying to bridge that gap. Absolutely,
we're trying to readdress that balance, whether it be with local government or central government, really having those conversations at the highest level with Westminster. We feel a responsibility as one of the biggest charities, learning disability charities, support charities in the country, to really take that on. And to work with other providers to really try and readdress this balance and bring it to the forefront of the public mind.
I know I was talking to somebody the other week on here, and she does a lot of work with providing information so that people with learning disabilities can have access to the same information. You know, in terms of support, there are things I think changing, aren't there? But it seems to be quite slow.
There are. Especially when you look at things like learning disability support, that kind of that trickle of information and the access to opportunities that everyone has, that you and I have, does tend to be slower. It's certainly got better in recent years, and it's getting better all the time, but still slow. And those services are vital as well. And we have many links with other organisations around about, because the sector is full of fantastic people doing fantastic jobs, and we need to bring it all together and make a real stand for everything.
What exactly do you have available in this area?
So we've just launched a really exciting partnership. So we've launched some local partnerships, and we are just about to kick off a really exciting national partnership. So the local partnerships that we've launched are with rugby clubs. So we've just launched a really fantastic one with the Leeds Rhinos, Wakefield Trinity. We're just about to start up another one with the Huddersfield Giants as well. So those partnerships involve local weekly fitness sessions for the guys that we support, and staff, because we need to look after our staff and ourselves, and including me. I think I'm going to go along to some of them. Match day experiences, which have been fantastic. The clubs have really looked after the people we support in terms of those experiences, and the staff as well. Access to tickets, access to players. We've had players come to some of our services.
Oh, really?
Where the guys live, and that always goes down a treat.
Oh, I can imagine.
Yeah, it does. It goes down really well. So we've got that going on, and that is leading in to a bit more of a national partnership that we've just launched with the Super League. So we've just launched, alongside the Super League, Community Integrated Care is the official social care partner of the league, and that is all going to start on Magic Weekend at the end of May. It's going to be a fantastic event, and from there each one of the signed up teams, and all the teams from the Super League have signed up, apart from the team in France, which we completely understand. It's a long way.
That's a shame.
It is. It's a long way.
You could go out there.
Well, yeah, it could have been an opportunity. So they from that point will have their learning disability teams, and we're really hoping, we're really excited that the local partnerships that we have with the likes of Wakefield, Huddersfield, Leeds will then lead and feed players into that league, and it's got such a fantastic feel to it. The Super League should be very proud. They've taken on that. A world first, and they've taken that on. I think other sports could probably learn a lot from this going forward, and there could be some really good opportunities for everyone. But it sits well, I think, with the values of our charity, and it sits well with the values of the Super League as well, that it's community based. Clubs are very much at the heart of their communities, as our services are. I
have to say that I did see the promo advert. It was incredible. It made me want to go and play.
It is. It's a really powerful video. And
it is, yeah.
Yeah, when it was first launched within our organisation, the concept of it, and the video was shown, everyone was so blown away by the video, the guys in the video, and the work that they've been doing with the clubs already. I mean, they're up for it. They're ready. They're ready to go. And we had some players along on that day as well who spoke very highly of working with the guys, of working with the people in our marketing department as well. I've got to mention John Hughes, the guy who used to work at a Super League club, and he also works for our charity, because he was being really instrumental in making this happen.
So he was a bit of a rugby fan anyway.
Oh, he's a massive
and
rugby
then he's
fan,
kind of linked you up with rugby. He
has. He definitely has. Because I think, as I've said, that the values of the Super League and the values of our charity come very nicely together, and they were certainly up for the idea.
What about, so you've said you're a national charity, what about nationally? Will there be any kind of additional teams joining? And obviously I know you said that the Super League are providing team structure.
Yeah, so as well as the Super League stuff, we do have other partnerships around the country with football clubs.
Okay.
So for example, Middlesbrough Football Club, we've had a 10-year partnership running with them as well. We've also got a partnership running with QPR and Portsmouth Football Club as well. That have all been established and running for quite some time, because we absolutely see the benefit between the socialisation, sport, fitness, activity, and that real sense of well-being that it gives people.
So do you play yourself?
No, I don't play rugby, but however, I will be joining in some of these sessions, because it really looks like fun.
What other things can we see from your charity then in coming future?
Yeah, so as I've said, we're really clear on our values in terms of lobbying on behalf of the sector, and really trying to readdress that balance. We're growing all the time as a national charity. We are growing our national footprint down to Birmingham, and around that kind of corridor towards London. So we've got a lot of new services opening, we've got a lot of new areas we'll be working in, and we're really excited about it.
It sounds very exciting. How do people get involved if they want to help you out?
So people can get involved through our website, through our Community Integrated Care website. We have a whole host of things on there around our volunteering opportunities, because people may just want to get involved in the day-to-day support. We have lots around that. We also have a lot of things on there around the Super League and how people can get involved in that from that aspect. So there's a lot of information on there, and people can access that quite easily.
And obviously, do you have to do fundraising?
Yes, we do. So we actively fundraise. We've got a lot of different things going on all over the country. We don't just fundraise for ourselves, we fundraise for other charitable organisations as well, because we think that's important, and the people that we support want to get involved in that, and they come up with a whole load of ideas that keep us going.
So you literally have something planned for every weekend?
Pretty much, yeah. I think Ben Nevis in August.
Oh right, okay,
Yeah.
So you're in training for that?
I am, yes.
Acclimatisation.
Yes, yeah.
Fantastic. Well, thank you very much for coming to talk to me.
You're welcome, thank you for having me.
Yeah, it's been a pleasure and really, really exciting.
Yeah,
It's very good. I'm looking forward to it.
It will, it'll be great.
If you wish to contact us about this or any other topic you see, our details are on the screen. I'm Emma Kirke. Goodbye for now.